A recent URMC study shows an increasing number of nursing homes across the state are pushing patients in their final months of life to do excessive amounts of rehabilitation. The study examined more than 600 facilities involving over 55,000 long-term residents throughout New York. Leah Lando has more on what the study found and what it means going forward.
720 minutes of rehab a week, in other words, ultra-high therapy. According to the study, it's increased 65% between 2012 and 2016.
Hours of additional rehabilitation services as they're approaching really the last month of their life. And some of these patients were actually receiving these types of services within the last week or even the day they had died.
Rehab plays a vital role in nursing homes, but Dr. Thomas Caprio says for-profit homes might be taking advantage of the system, profiting off patients doing excessive amounts of unnecessary rehab in their final days.
Having that amount of rehabilitation services could actually contribute to some of their discomfort, impact their quality of life, and contribute to their suffering.
Dr. Helena Temkin-Greener says many for-profit nursing home staff were more concerned about reimbursement for their services than they were with supporting end-of-life care.
Even though staff may see what's happening, their nursing home is pressuring them to provide a different kind of therapy because it pays more.
Matthew Rossman is the rehab director at St. John's, a nonprofit facility. He says each assessment should be case by case.
We base it on need, what their goals are, what they can tolerate, and what their preferences are. It's usually fairly obvious when it's time to change what we're doing or maybe step back from treatment at all.
According to the Department of Health, patients should have the final say about how much rehab they receive. If they don't want to take part, they shouldn't have to. Leah Lando, News 8.
Leah, thank you. The URMC researchers found the facilities with a higher percentage of registered nurses had lower rates of excessive therapy, and they can notice patients approaching the end of their life much sooner. It's important to note this study was conducted using administrative data after the patient had passed away. No personal experiences were included.